On to the serious business of politics, sometimes not so serious, but it is in this case, and it's a worthwhile discussion to have with Representative Tim Murphy. He's a Republican. He represents the 18th District in Pennsylvania. He tweets at Rep. Tim Murphy, along with Doris Matsui, a Democrat from California, introducing a bipartisan congressional resolution declaring May as Mental Health Month. First of all, Congressman, welcome back. Thank you for being here today.
It's great to be with you.
Where did this come from?
Well, May has been Mental Health Month for a number of decades, and what I've been working on for the last few years has been to get Congress and our nation to change the way we deal with mental illness. I mean, it very much is in the shadows despite its huge numbers. Some 60 million Americans any given year will have some level of diagnosed mental illness. Among children, it's about 17.1 million. That's more than the number of kids with cancer, diabetes, and AIDS combined. And most psychiatric illness begins to occur in the teen and young adult years. But what is tragic in this is we do not have enough providers to help. There are government policies that actually block appropriate treatment. We do not have enough access to care. Insurance companies oftentimes have pushback in people getting care. So we are really trying to say this is a brain disease, this is an illness, it needs to be treated as one, and stop the barriers to getting care.
This, and for people who don't know, by the way, Congressman Murphy's also a doctor, a PhD. I wanted to ask you about this is not something that's new to you, though, because you've got a history of putting out legislation, not this resolution, but legislation, the Seniors Access to Mental Health Act, which is something you authored. You also put out the Generic Drug Biosimilar User Fee Act, but there was also related to health care, the Helping Families in Mental Health Crisis Act. So I'm wondering, the mental health side of things, which truly is, it's interesting how our insurance companies even treat it differently. It's that if you have a mental illness, it's not quite the same as if you have a physical illness. A broken arm, we know what to do. A broken mind, we don't quite know what to do, and it gets treated a little bit differently. So I just wonder where it is that you got your incentive to get so involved in this particular aspect.
Well, I've been a practicing psychologist for, it's getting close to 40 years now, and I currently practice as a Navy officer at Walter Reed Hospital in the Navy Reserve, where I work with PTSD and traumatic brain injury service members there. So I'm still working it, and experiencing these things. But what happened is, in my role as chairman of the Oversight and Investigation Subcommittee on Energy and Commerce, a couple of years ago, really began a more in-depth investigation after the Sandy Hook Elementary School shooting to say what is going on here with these tragedies. Why nearly 40,000 Americans commit suicide? Why 43,000 have opiate and drug overdoses? Why are half the people with severe mental illness not treated? And so as we dug deeper into this, we actually found a number of federal policies which stand in the way. And what has happened in this is in introducing the Helping Families Mental Health Crisis Act, which, by the way, I'm going to reintroduce in a couple more weeks, and see if we can get it passed this time. But I have heard we've heard from hundreds, thousands of families across America who tell us of the difficulties they find with insurance companies, for example, not really recognizing parity, setting a cap on the number of days, with the federal government saying you can't have more than 16 beds in a hospital, you can't see two doctors in the same day. We have HIPAA laws that instead of helping patients make connections to get care, oftentimes they block doctors' ability to get history and get family members to help out. There's a whole host of problems, and we recognize we have to change these things. This isn't just an attitudinal issue of saying it's stigma and let's just change our minds about this. We've got to recognize it's a brain disease, attack it like cancer, attack it like diabetes, attack it like AIDS, and say we can indeed treat people with mental illness if we are serious about this and stop those tragedies.
You mentioned some of the policy restrictions or the blockades, if you will, obstacles right now. Can you mention a couple of them just to give us a sense of what you're working against?
Well, for example, Medicaid says if let's say an adolescent is beginning to show symptoms of withdrawing from friends, grades going down, having a number of problems, and the pediatrician says, I'd like to refer you right away to a psychologist. Let's get to the bottom of this. Medicaid says, nope, you can't see two doctors on the same day, come back another day. But we know when that warm handoff occurs in the physician's office, you have about 95% plus follow-through and compliance, which, of course, is a better prognosis. If you have to come back another day, it drops below half. There is a rule that for people ages like 22 to 65 or so, Medicaid isn't going to pay if you have more than 16 hospital beds. It's a bizarre rule that I think was set up in the days when we wanted to get rid of the asylums. What happens now is we have a critical shortage of beds where someone needs to be in a hospital for psychiatric care short term. We don't want to bring back the days of those sprawling asylums, but we do want places for people to go when needs to get stabilized. We want to also make sure that the barriers that occur now between mental health funding and substance abuse funding for states, we can tear down those barriers so states can use those together, since a large portion of those who are abusing substances may also have mental illness. In part, they're turning towards drugs as a self-medication. The last thing I just want to mention is a report that's going to come out soon is going to indicate a number of problems with how federal grant programs are out there without real accountability, without real demand for data. We're going to refocus these efforts so they are working on applied research, applied grants for those who are showing early symptoms, for those who have signs of mental illness, so we can get into this and bring the treatment to folks.
Congressman Tim Murphy is with us here on POTUS, and you mentioned before you work at Walter Reed. I wonder, is this an especially difficult issue in treating veterans, this disparity in how we view mental illness as opposed to physical illness and how that manifests itself?
Well, first, compliments to the Department of Defense in recognizing the need to change their approach a few years ago. And they have been much more proactive in getting care to veterans. What service members, what a problem occurs when they transfer out of Department of Defense and go to the VA, where there are shortages, and across the span there's shortages of trained psychiatrists, psychologists, clinical social workers. But the VA also has these barriers that say they have a drug formulary, and if you may be on another medication, but come to the VA and they're going to switch you back to something on their plan, even if something is effective. But you can appeal it or something along those lines. I just introduced a bill to change that, saying that a veteran is stable and doing well on a medication. Why would you take them off and switch into something else just because it's cheaper? But unfortunately, we have about 22 suicides a day among veterans, about one every 65 minutes, one active duty a day. So it tells us we still have a long way to go to help our veterans and service members be aware of some of the problems that occur with deployment, with combat. But we've got to help them understand the message. You can get better. There are treatments available, and don't denial about that. Let's get them the help they need.
Congressman, I appreciate you joining us this morning. We hope we'll catch up down the road as you reintroduce this legislation.
Thank you. It'll be important. We'll need the support of America to get this moving through so we can get it through Congress. Thank you so much.
Thank you. Representative Tim Murphy, he's a Republican from the 18th District in Pennsylvania, as you mentioned, practicing psychologist, and he tweets at Rep. Tim Murphy.